Well, 15 minutes to talk about NDIS is just really, really underdone, I've got to tell you. But anyway, I'll do my best. Everyone knows it's an individual. Oh my God, those lights! It's an individualised funding model that we have. So we actually develop a plan with an individual, and that will include all their support needs to enable them to be more independent and to increase their community participation in all kinds of ways. So it is an insurance approach, and many of you would be very familiar with that approach. It means that we are actually looking to develop the lifetime cost of services to support that person throughout their lifetime. So we're looking at the population that is under 65 years of age, and up in the Hunter it's all age groups, so from little children through to people who have not yet quite attained 65 years of age. Choice and control around the individual's selection of how they want to live their life and what kinds of supports they actually want to utilise is very much a guiding principle of the scheme. So we are moving away from the fact that there's a budget that governments develop and say, you know, if there's 1,000 people or 1,500 people or 2,000 people, you all get a bit of it. This is about individualised funding, exactly as you would find in all personal injury schemes. And importantly, picking up on Anne's point about the regional and remote services, it is to be delivered in local communities. It's not a centrally bureaucratically driven system. And we're in the Hunter and we're in other designated spots, but we are working towards attaining national coverage. So at the moment, we started off last year, almost 1 year ago now, as of next Tuesday, in South Australia, where we're looking at, and you need to understand also, we're not only in different geographical areas, we're also targeting different pilot populations. So, for example, in South Australia, it's children up to 14 years of age, and we started with the very young ones under 3, and it's right across the state. So we commenced in Adelaide, and we're now starting to move out into the broader geographical areas of South Australia. In Victoria, that's a very similar site to what we've got in Hunter, in that it's located in Geelong and around the Barwon region there, and it is all age groups, 0 to 65. Down in Tasmania, it's a statewide scheme, but it's actually looking at the 15 to 24-year-olds, so those, later adolescent, young adult population there. Then in Hunter, as I've said, it's all age groups. As of Tuesday, we start our new 3 sites. One over in WA, which is in the Perth Hills area, all age groups, but geographically contained. In ACT, it will ultimately be the whole of the ACT and all age groups, and we will start through a phasing arrangement. And then in the Northern Territory, and that is in the Barkly region, and this is the real test of remote. So that's around Tennant Creek, for those of you who don't know your Australian geography really well, but anyway, it is very remote, I can tell you. So people there actually access services from, what there is in Tennant Creek, Ellis Springs, but also Mount Isa. So it goes across state borders. So that's the new challenges. We do have phasing arrangements in each of our sites. So obviously, in the Hunter, for example, over the 3 years of the trial, we anticipate bringing in something in the order of 10,000 people. Well, clearly 10,000 people couldn't start on the 1st of July 2013. So there is a phased arrangement, which we agree with the New South Wales Government. The other important aspect of this is a partnership between all the governments, so it's not just the Commonwealth, it's all the state governments as well, and they are all at the table in terms of the policy development and decision making, and at the local level they very much influence the way in which we actually operate within the jurisdictional boundaries. So a person has to have a permanent disability. The age group at the age range applies, and their disability is expected to have a big impact on their daily life and their ability to participate in community activities. And one of the other criteria is that they will need supports in an ongoing way. So it's not for those people who may have a temporary impairment as a result of surgery or some hospitalisation. It is about people who are going to have a permanent and significant disability. So I've said already it's very individualised, so there's a plan developed for a person. That is a plan for the time. It always has it covers a period of time. And in our trials, we're actually trying to have plans that do go over a 12-month period, but obviously with some people who will have more rapidly changing needs, such as little children, such as someone who's had a recent onset of disability, then that will be a shorter period in that plan. The other important aspect of NDIS is it is not just about what we fund. It is also about ensuring people have access to ordinary mainstream community services. So part of a plan can simply be how a person might better access those services, or how they will make use of other funded services, because everything is not going to be directly funded on an individual basis. There will be, and if those of you who read the Productivity Commission several volumes, will have noticed that there's a thing called Tier 2, and that is where services are funded to be there for when people need them, and they're not being actually sought out on an individual basis. And then the plan will also have those supports that the NDIS will actually fund for the person. So I've talked about that. I'll just move on. Another important thing we've already talked about from both the Commonwealth's perspective and also Anne's talk about actually sustaining families and carers. So having the appropriate environment and support so that people can be allowed to be as independent as possible, and their family can have a normal family relationship with them, rather than being heavily burdened with being the carer rather than the spouse or the offspring. So that's an important part of what we're looking at when we're developing a plan, and we can actually fund support. So one of the words you don't hear in our terminology is respite. But we are actually able to fund time away or different types of supports that actually enable people to have some time, either for the family to do other things or the person to have time away. So I think that's very important. The other aspect of our work is that we're not meant to duplicate or replace any other natural funded support. So we do have some issues when we run into the intersection issues. So with health, with education, with transport, and that is going to go on throughout the trial. I mean, we encountered it very early in the work we were doing in each of our sites. And as time goes on, we've got to work through how we actually will make that work post the actual trial period. So we use the term reasonable and necessary, and those of you who work in the insurance world would be very familiar with this term. So it is a bit of it's a bit of a disadvantage to us. They didn't take the opportunity to just turn the words around and first of all say necessary. And the necessary is about, it's meant to reduce the impact of disability and to enable a person to be more independent or to participate more in community activities. So that's the necessary part of it. And then comes the reasonableness, what it is that NDIS itself will actually fund. And that is a decision that the agency planners have to make. So we've got a couple of decisions. First of all, does a person meet the age, residence and disability requirements? And then, so that's an access decision. And then when we're putting together their plan and the funding in there for their supports, what is reasonable and necessary to fund? So we're looking for those that add value, that are value for money, that are proven, hopefully, to be effective and beneficial, and that's where we run into some issues. They should be consistent with good practice, as it's known in that particular field. They are definitely about promoting independence. So we won't be funding more hours of personal care. That is not about the person being able to be helped to be more independent themselves. On the other hand, and this is the area you'll be interested in, we will actually fund pieces of equipment, adaptations that enable a person to be more independent and not have to rely so much on actual people's assistance. It's meant to strengthen the sustainability of family and community supports, and you would all know from your work how much making a house more accessible can really assist a family to maintain a normal living arrangements. And the really one of the strong criteria we look to is the value for money, the return we get on actually in our investment. So aids and equipment, we are doing things a bit differently from what you would have seen in the past. So we can actually fund any type of assistive technology, and in my head I always include adaptations and modifications to home and workplaces as part of the assistive technology group or category. So we fully fund. We don't ask for co-contribution, and we certainly do want good prescriptions. So that's an area that we've got to work with the professional associations on. We see it as an investment, so a lot of the money that we put towards these things will actually be managed by the agency rather than given to the person to manage within their own budget. They can choose from a range of equipment items. It needs to be fit for purpose to actually meet their needs. If they've got a reason, and I usually describe this as a bit more of a cosmetic reason for having something a little different, they can fund that extra. Or alternatively, we may determine that this type of thing from here is actually reasonable and necessary, but they've got a desire for whatever reason to have something somewhat different that wouldn't achieve any different functional outcome for them. So that is their choice, and they can, if there's a cost differential, they can meet it themselves. Compared to the other usual state government schemes, we do include things like car modifications and also equipment for recreation purposes. So this is my little graph I used to show you that green bar there, which is the well-supported through refereed literature, etc., that actually says, yes, this gets a tick almost immediately without much thought. There's not a lot of that around in the world in which we work, unfortunately. So we do go down into greyer areas in terms of the evidence for beneficial outcomes. One of the things we can do is actually develop it, allow a person to trial something, so we can actually assess whether or not it's likely to achieve a beneficial outcome. So, because we're very much focused on what it is that will make a difference to the person. So up in the Hunter now, we've got 87 staff, and the planners are the people who work with individuals to actually develop their plan. The local area coordinators help give effect to that plan and make sure that the person does have the capacity to implement it, or if they need further assistance, that can be included in their plan. The regional support officers likewise work along with the local area coordinators. The coordinators also have another role, and that is a community development one. So we don't want everything to be just around the individual. We want at the end of the day that the hunter, in this particular instance, will be different. It will actually allow greater inclusion of people with disability rather than they being an isolated group that has to always access things individually. And then we've got support staff who have a lot of client interaction, so they are the ones often that are the first port of call for both participants and providers. We are working with Enable in New South Wales. And so that because they obviously have their budgets for their regional services, so we are making use of that. However, we are supplementing what is coming through Enable as well. And we are looking to see, because we very much appreciate the work that they've done in actually getting greater efficiency through their procurement initiatives, and that is the same in a couple of the other states as well. And we're also looking to work with the professional groups to ensure that we do get best practice in equipment prescription and follow-up. One of the things that I'm very keen to see is that we make sure that there is no abandonment of the equipment that we actually fund, that people are able to make use of it. If it's not fit for their purpose, it can go back into a pool for the use by somebody else. So we've got a lot of service providers of all types. And we've actually started with the New South Wales Government in actually planning for people who are residents of Stockton. So a large variety of people with different disabilities have started, have their plans completed now up in Hunter. And over 400 actually have equipment or home mods included. Big learning trial for us. Didn't have a lot of time to learn before we started, so the learning is happening on the job. So it's an action research project, if ever I've seen one. We live it day in and day out, so that's what we're doing. You have to bear with us through that. One of the things we know already is that people are a little hesitant, if not to say a little cautious and frightened of what this NDIS might mean. So we have gone away from our, enthusiastic, over-energetic, let's get into a plan that's going to be different for you, to actually saying, let's just see if you're going okay, and if you need anything else right now, and we'll be here and we'll come and talk to you again. So as I say, it is very much a work in progress, and we are now putting a stronger emphasis on the need for an evidence base for anything that we do, our decisions that we've made. We are streamlining a number of processes, which has certainly made a difference if anyone bothered to read our reports, if you could see the difference between July to December to January to March. I think we doubled the number of people who actually had their plans completed in that time. So we've also started to produce better guidelines for everybody. They're public guidelines. Everything we do is in the public domain, so there's no secret documents that we hold and we actually utilise that won't be available to a participant or a service provider. And one of the things that we do know is there's very little understanding of the concept of reasonable and necessary. So we do need to do a lot more work on that. So we actually have got a national project running also to look at equipment schemes, and as I said, we include home modifications in that. There's been there is a lot of public talk about high cost of aids and equipment and other things. We are a small market in Australia, and we haven't come down in a firm way on how this should work. We do like the idea of some procurement initiatives, but we've always got to be able to deliver out there where the person is, and so that means often having suppliers who are easily accessible to the person. So it's balancing all of those things that we need to look at in a national model. And as I say, we're looking to leverage market power. This may mean also some greater connection with the aged care sector, and also with the Department of Veterans Affairs. All of those things are being thought through at the moment. And we've got one initiative we kicked off with the Independent Living Centre here in New South Wales, is trialling what we're calling assistive technology mentors, who are people with lived experience of disability, either as a carer or as a person themselves with disability, and they are undertaking a course that we hope will eventually get up to be about a certificate for, to actually assist people with the lower end of complexity of aids and equipment. So that actually has just started, and that work is underway now, and it's being done in both Tasmania and the Hunter sites. So one of our other big things, of course, is about risks and making sure that the person is getting what they need through their plan and has if they want to self-fund, they have the capacity to manage those funds. So I'm leaving all questions until we actually are on the panel, I think, of which there seems to be a huge number. So I'll leave it there. Thank you all very much.